Hello, I'm Ben Wattenberg. The war on drugs is now 8 years old, but are we winning? Some say that we need a new approach that could solve the criminal, economic, and health woes of the drug epidemic. How? Legalize drugs. Joining us to sort through the conflict and the consensus are David Boaz, Executive Vice President of the Cato Institute, Diana Gordon, Professor of Political Science and Criminology at City College of New York and author of The Return of the Dangerous Classes, Drug Prohibition and Policy Politics, John Walters, President of the New Citizenship Project and acting drug czar in the Bush administration, and Peter Reuter, Professor of Public Policy at the University of Maryland and author of Disorganized Crime, The Economics of the Visible Hand, The Question Before the House. Should drugs be legal? This week on Think Tank. Drugs are everywhere today. Some, like alcohol, are legal, but most, like pot, crack, smack, PCP, LSD, MDMA, uppers and downers, are not. America's streets are awash in the violence that surrounds drugs. In particular, the emergence of crack cocaine in the 1980s presented a new and dangerous menace.
The gravest domestic threat facing our nation today is drugs. It's turning our cities into battle zones, and it's murdering our children.
In an effort to reduce addiction, the federal government got tougher on traffickers on land, sea, and air. To stem the flow of drugs, they also enacted tough, mandatory minimum prison sentences for drug offenders. At the local level, police stepped up arrests of people who sell and use drugs. All this caused the number of inmates jailed for drug offenses to rise dramatically. In 1972, judges sentenced 3,400 drug offenders to our federal prisons. By 1993, that number had risen to 43,500, with 140,000 more in state prisons. In that same time, marijuana use declined after peaking in the late 70s. Cocaine use declined as well, but both drugs are still widely available. But with all the billions that we have spent, drugs are still making it to the marketplace where there are plenty of buyers. Should we try a new approach? Legalization proponents argue that interdiction has failed. They further argue that crime would be reduced if legalization occurred, both by freeing up jail space for violent offenders and by eliminating the profit motive from the drug trade. Okay, first question, the obvious one. Should we legalize drugs? David Boaz.
Absolutely. Drugs are bad, but the drug war is worse. First, in a free society, adults ought to be able to decide what they'll put in their own bodies. And second, the drug war is causing these skyrocketing levels of crime in a lot of major cities. We've had murder records set from Washington to Richmond to Fresno the last few years. A lot of that is drug related, and legalization would solve some of that.
All right, Diana Gordon.
While I would definitely scale down the drug war, I'm not ready, with the exception of the hemp products, marijuana and hashish, to recommend complete legalization. I think we don't know what the consequences for abuse would be, and I'm concerned that we overstate, that the legalizers overstate the effects on violence in the inner cities that we would have if we did legalize.
Okay, Peter Reuter.
I essentially agree with Diana Gordon. I do not think that the legalizers have made a compelling case. On the other hand, the alternative is not continuing what we're doing now. And unfortunately, I think the question focuses just on extremes. Do we be very tough the way we're trying to be now, or do we legalize everything? And the answer is almost certainly in the middle ground. And like Diana, I don't think it's all or nothing with respect to the legal status of psychoactive drugs. We have legalized alcohol really as a matter of history. We have prohibited essentially all other psychoactives, and I think that there are decisions one can make about some psychoactives, such as marijuana, that is change them to legal, maybe prohibit alcohol, and leave others alone. And I just think the question is the wrong question.
John Walters. Why do you say I asked the wrong question? Peter. Yes.
Well, I obviously don't believe we should legalize drugs. I think the issue of crime is much to do with the psychoactive effect of the drugs on individuals that make them more violent, that cause worse consequences of behavior. Places where we test in major cities, people involved in homicide, assault, domestic violence incidents, 50% plus are on drugs at the time of the offense when they're tested, when they're arrested. It's not just the business of selling drugs and the criminal activity that causes violence, it's the effect of the drug. And alcohol has a terrible effect here too. I mean, the question in part is, you've got 100 million drinkers in the country, use alcohol once a month, we could tell 50 million smokers. I think if we had to do it over again and we're trying to drive down the abuse in those categories, why do we want to add to that legalization, which will almost certainly increase things like crack consumption, heroin consumption, and lead to a larger number of casualties than we have now?
Though nobody cares much about marijuana, I think it's really important to put that in discussion of the form the propositions of the form that John's made. Look, legalizing marijuana might reduce, there is some research evidence, might reduce alcohol consumption. We have a serious alcohol problem. We might be better off with a slightly more serious marijuana problem and a substantially less serious alcohol problem.
Now, why would legalizing marijuana cut alcohol use?
It turns out that that as alcohol became less available to high school seniors with the imposition of the higher drinking age in the late 70s, there's some evidence that switched people to marijuana. It is arguable, an argument is all that it is at this stage, that if we made marijuana more available, there'd be more use of marijuana and less of alcohol. Neither of them is a desirable good to consume, at least in large quantities, but we may be better off with more marijuana and less alcohol. The point is to make it substance specific.
Right. David Boaz, let me ask this question. If we legalize drugs completely, as you say, wouldn't we make it easier for young, innocent kids to become addicted to drugs? And then, as John says, they would become more likely to become criminal.
I don't think...
If you could buy a drug the way you buy a six-pack of Coca-Cola, wouldn't more people buy it?
Well, nobody's talking about making it as legal as Coca-Cola. We're talking about making it as legal as alcohol, which is to say it's going to be sold in regulated stores, it's going to be sold only to adults, things like that. Currently, cocaine is sold on school playgrounds. I think it's sold on school playgrounds more than alcohol is, and that's because there's no legal distribution system. So the distribution network for cocaine is entirely illegal. Therefore, it's easier to take it to the schoolyards and the playgrounds.
You would also legalize heroin? You would legalize heroin?
Yes, for adults. And I understand that when you legalize it for adults, you are not going to completely keep it out of the hands of kids. But we're not keeping it out of the hands of kids now. We're arresting 13-year-old drug dealers. So that suggests to me that prohibition doesn't stop kids from using it. I don't think you would have an increase in underage use. You'd probably have some increase in adult use. And at least for marijuana, as Peter says, that might actually be a good thing, depending on what they gave up.
John, what do you think about marijuana legalization?
Well, let me just say two things here, because I think the premises of the discussion should be brought out. One, part of the premise seems to be here that we haven't made any progress, we can't make any progress, we're drowning in this problem, and therefore we ought to take a different tack. That's just not true. The information that we have in surveys are not as reliable and as perfect as we'd like, but what the evidence we have shows us is overall drug use in this country declined by 50% from the peak that we were able to measure in 1979. That's all illegal drugs. Cocaine use dropped by almost 80% between 1985, its measured peak, and 1992. We've made enormous progress. A lot of that has to do with prevention and changing attitudes, but it makes a difference what the institutions and what intellectual and political leaders say about this in changing those cultural attitudes. My argument is that's an enormous cultural success. If we could reduce dropouts, illegitimate births, HIV infection by 50 to 80%, we would consider that an unbelievable achievement.
Yes,
We've
but
done
how good are
that.
those figures?
We've done that with drug use, and I'm not as optimistic or as sanguine about marijuana use as Peter. Depending on how you measure addiction, marijuana users can form the single largest group of addicted people, whether you use criteria of measures of use, how you change your behavior, other kinds of patterns to classify someone as an addict. Marijuana can be the single most addicted of the illegal substances. And the other factor that I think you've got to mention here is people want to turn to treatment. You have to look at the problems of treating hardcore users. We do not have very reliable methodologies, once people get in trouble with drugs, of taking hardcore users and moving them out of drug use and into a productive life. If you go down this path, you may not be able to get back.
I think that it is certainly true that marijuana is not nearly as dangerous as some of the legal drugs, and I think it's untrue that it is as addictive as all the other illicit drugs, certainly not as addictive as either tobacco or alcohol. But I don't think...
I don't think you can sustain that about alcohol. I mean, the capture rate for alcohol, that is the percentage of people who use alcohol regularly become heavy dependent users, is probably 10-15%. I think that for marijuana, it may be somewhat higher than that.
You may be right.
But marijuana does not cause the physical devastation that either drinking or smoking does.
The word addiction is the problem here. Look, people who are dependent on marijuana have a problem. They don't have a problem as serious as either alcohol dependence or cocaine dependence. In terms of both the physiological
or
consequences
tobacco dependence, if we're talking about mortality rates.
Certainly in terms of mortality rates either. So yes, I'm not arguing that marijuana legalization would lead to more marijuana dependence. I'm just not sure that that's a comparable problem on the individual level as alcohol dependence.
I think we ought to be careful about saying that we're making progress too. These statistics, these polls are very dubious. You ask people if they're engaging in illegal activity, and you've got a lot of public pressure against that illegal activity, maybe there's a tendency to start under-reporting more than you used to. When we look at some things we can see, crime rates, murder rates, prices of drugs, it doesn't seem to me we see much, and the amount that the federal government is spending on these things, doesn't seem to me we see a success there.
Well, I think if you look at the data about testing of arrestees, the percentages in some areas, especially when enforcement was intensified, went down. You still have violent crime. You have a legacy that may be partly generated by drugs, may be generated by other factors. I don't think we know enough to be specific about causal sources. But in terms of spending, I would like to point out that despite, look, $1 billion is a lot of money. I haven't been in Washington so long that I forgot that. Right. But during the entire period from the 70s, even including the 90s, where the drug budget started to approach $13 billion, the federal government spent more on NASA in every one of those years than it spent on drugs.
Diana Gordon, you have made the case that this whole war on drugs is driven by politics. Is that your view?
Yes, I think that the drug problem is really a kind of vessel for a lot of kinds of concerns, discontents on the part of the public, ambitions on the part of the politicians. I think the drug problem serves many purposes, and that
but isn't it a real problem? I mean,
of course it's a real problem.
You've got people going rat-tat-tat, killing people.
But I think it's such a real problem that I don't think it can be solved by drug policy alone. I think both the prohibitionists and the legalizers make the mistake of thinking that with either much tougher law enforcement or complete legalization, you're going to solve the problems of drug-infested communities. Drug-infested communities are also communities with many other problems. And I would be in favor of legalization if we were coupling it with a program of social reconstruction for those communities,
but
which would deal with the sources of abuse.
Just of marijuana and hashish, not of the others.
Well, I think if we could combine it with a kind of a real program for the cities that addresses the other factors that John has acknowledged are probably present in these arrestees who are also on drugs, then I would favor legalization for all drugs.
Can I rescue the standing of the drug warriors, not particularly friends of mine, but I just don't think it's fair to say that this is simply a vessel. No doubt things have been loaded onto the drug war that do aid other political agendas. But I mean, from my dealings with people who have been sort of, leading warriors, they believed that this was a serious problem for which the only response that was appropriate in the short run was tough enforcement. And that's a very broad, there's a very broad support for that in Washington. Now, in part, just, Washington leaders felt they had to do something in face of this large problem. The only thing the public believed in at the time was tough enforcement, and they did it.
John, let me ask you one question. You are a hawk on this stuff, put people in jail. There is a case that I hear made among some criminologists that putting a drug dealer in jail doesn't mean that you eliminate that market share. You simply have another person springing up who will take his sales. So what on earth is the sense of all these big mandatory minimums and everything if you're really not getting rid of the problem by putting these guys in the slammer?
Yeah, let me also correct what I think is a misunderstanding about exactly what the emphasis was in, at least during the Bush administration. There was never the approach that we simply do enforcement. We tripled federal spending on treatment. There's a problem here because there's a problem in the way the bureaucracy delivers money in this as in other areas, and the number of treatment slots didn't increase during that period. Other state and local governments spent on that. The biggest single increase in activity was, I think, prevention, which is hard to measure in dollars, but people got energized and started talking to young people, creating workplace prevention programs. Society changed its attitude in a number of ways that federal budgets don't measure that were crucial to changing the patterns of use here. The issue of enforcement is simply a matter of, let me rescue common sense on the enforcement side. Where we have the single biggest problem today is crack addiction. It's 3/5 of the money spent on cocaine. So if you want to talk about legalization, you don't want to talk about crack, let's remember we're going to have a huge drug market and drug activity continuing. But in terms of crack addiction, the problem here is if we're in the suburbs today where the drug problem is not very extensive, if you have an open-air drug market in the suburbs, there's no question. You close it down, you arrest the people, you keep them away from kids and your neighbors. It's only in the inner cities where for some reason our society has tolerated open-air drug markets. You want to see what drug legalization looks like? Go to an open-air drug market. The drugs are cheap.
That's completely
The drugs
wrong.
are cheap, they're free,
wrong.
they're available, and that is where you have the greatest number of casualties. The casualties of cocaine and heroin today are 80% in the inner city, they're 60% black as far as we can measure them, and they're the poor. And that is where we are not doing a job. We're not doing a job of delivering services on a variety of areas, but we're also not doing a job of simply making the streets safe.
John,
Tremendous
that's
proportion.
like saying that the way to look at what alcohol legalization is like is to look at the Al Capone gang. Obviously, Al Capone was what happened under Prohibition. And the open-air drug markets in the inner city and the Rayful Edmonds gang in D.C., that's what happens under Prohibition. Under legalization, a drug market would look like a liquor store run by a mom and pop. Now, you may not like that, but it ain't Rayful Edmonds, it's not an open-air inner-city drug market. That's what you get under your
You
system.
would get more
And I
drugs legal in circulation that kids would get, because
Well,
mom and pop could go in and buy it legally without risking arrest. They'd bring it home, and the kids
Well,
use it.
I disagree with more kids getting it. I think through the illegal system of funneling it directly to the playground, you're actually getting more kids into it. But more drugs in circulation, yes, I think that's possible.
Yeah, but the
but
fact-
people
you know,
would know
the
what
fact
they were
show-
buying.
Let Diana go.
A lot of the violence that we are concerned about that is connected with the drug problem is really the violence of drug transactions gone wrong.
Dealer killing dealer.
Or dealer preparing himself for the arrival of the cop, or something
Suppliers
that's an
and dealers,
accident, right?
just different.
Really a kind of accident. And it seems to me that legalization would at least give you control over that kind of violence. Now, one of the reasons I'm a little skeptical about legalization is that I don't think net violence in the inner city communities, which are plagued with so many other problems, is necessarily going to go down. Where are those small retail dealers going to get the income that they now get from selling drugs? Arguably, mugging and carjacking are more directly likely to produce violence than drug transactions.
Let me ask this to the legalizers. Isn't there an historical analogy at work here? As I understand the history of drug use in the United States, in the early part of the century, we also had a drug epidemic, a cocaine epidemic. And what we did was go into a full-scale, quotes, war on drugs, including interdiction and prevention, and movie stars and everything else saying don't use drugs, reefer madness, whatever it was. And in point of fact, drug use went way down, and it worked, the war on drugs, and then it lay sort of at low levels for a couple of decades, and then it came back up. And doesn't that model say that we should do it again?
I think reefer madness was a political hysteria. I don't think there was a
No, but-
big cocaine epidemic. If you look at the history of the United States, you don't see the kind of hysteria about drugs that we've had over the past 10 years or so. You referred to the drug war in the opening comments as having lasted 8 years. I mean, you can look at it as having lasted 20 years, 30 years since Nixon, 75 years since these things were started. And at no point have we been able to eliminate drug use.
No,
we
but
tried
it
prohibition
went way
with
down,
alcohol,
I guess, in
and
the
that
20s
didn't
and
work.
30s, as I understand
But you're assuming that it went way down because of the campaigns and because of law enforcement, and that's not at all clear. There were larger forces. You know, you
Such
send
as?
well, you send the most vulnerable groups of young males off to war, for example, and notwithstanding that you could get a lot of heroin in Vietnam, you couldn't get that in World War II. There are lots of...
Yeah, I mean, it's important to see these as epidemics. I mean, that's the usual phrase. We talk about drug epidemic. Epidemics tend to burn themselves out. Maybe policy, being tough about drugs, changing attitudes about drugs, will shorten the epidemic, make it less intense. But basically, what we're looking at are cycles that look like cycles of epidemics. Crack is a drug which affects regular users pretty quickly, and the crack epidemic ended fairly rapidly in the sense that you didn't get a lot of new users after about 1987. People who become dependent on crack are still with us and maybe with us for another 20 years. Our drug problem is not the problem of lots of new users as it was in the early 80s. It's the problem of a couple of million people who are addicted in the last...
So we are making progress. So
and-
John is right in that sense.
But it's not the
I'm
war.
not saying
What
anything
Peter
about-
is saying
right.
is that the word gets out. PCP didn't last very long. People heard PCP is bad stuff. Then they heard crack, and they could see that crack was bad stuff. So it wasn't the war on drugs, it was observing the use of crack.
Well,
With
I mean,
street
look,
smarts.
you're more definite about it than I'm willing to be, but clearly a big influence here is simply changing attitudes, the end of an epidemic of initiation. What's peculiar about drug epidemics is people don't get cured. They stay addicted. Lots of them stay addicted for a long time. Most of our heroin addicts are literally the same people who were addicted to heroin in the mid-1970s.
What about the argument that's made, I mean, Jesse Jackson makes it that you have two forms of cocaine, crack and regular cocaine, and that the police arrest and get very tough on crack on blacks in the inner city, which is the drug of choice, and kind of lay off the suburban whites who use cocaine. Is that valid?
Well, there's been a kind of, I think, misunderstanding of the history of harsher penalties about crack. When the harsher penalties were passed in the mid-'80s, it was not as clear that crack was an inner-city problem. It was clear that crack was much more dangerous and addictive, and the effort was to protect Americans. And I think today you have to ask yourself, if you want to be less forceful in protecting Americans in the inner city, where the crack epidemic is focused today among addicts, what are you saying about your concern for black Americans, who are the principal victims in the inner city? Today, the problem is crack, if you talk about the drug problem and the money and the violence, and that problem is focused in the inner city. It's not cocaine powder, it's crack, and if you don't deal with that, the rest of this is kind of nibbling around the edges. And the problem is very few people, David may be an exception, are going to say, we want to make crack as available as Jack Daniels.
Okay, we have time just for one brief statement from each of you going this way about your principal idea in this whole argument. Starting with you, John. One or two sentences.
We've made a lot of progress. We need some leadership today. We've lost that leadership. But the answer to this is to follow through, and particularly by individual citizens talking to their children. Young people who don't use drugs by the time they're 18 are unlikely to use them
Cut
later.
the demand of it. Peter.
Remember that policy is a small part of what affects this problem, and that our choices on drug policy are not at the extremes of what we're doing currently and legalizing, and we should be doing a lot of work on figuring out where we want to be in the middle of that.
All right, Diana?
We should scale down the drug war so that we don't get distracted by it from the real sources of serious drug abuse,
Which
I think are poverty, inequality, poor education, all of those things
David?
that liberals cite.
John is right. Parents, teachers, ministers should tell people about the problems with drugs, but the legal war, the military criminal war on drugs is failing. There's no light at the end of that tunnel, and we should legalize drugs for adults.
Okay, thank you, John Walters, David Boaz, Peter Reuter, and Diana Gordon. And thank you. As you know, we enjoy hearing from our audience. Please continue to send your comments and questions to New River Media, 1150 17th Street Northwest, Washington, D.C. 20036. Or we can be reached via electronic mail at thinktv@aol.com. For Think Tank, I'm Ben Wattenberg.
This has been a production of BJW Incorporated in association with New River Media, which are solely responsible for its content.